You're listening to Cancer Convos with Brady and Stacy.
Hey there! Welcome to another edition of Cancer Convos, sponsored by Chelsea Smith Cosmetics and the Bismarck Cancer Center. I'm Bob Brady.
I'm Stacy Sturm.
And we have a guest today.
We do have a guest today, a friend of mine, and I can call you a friend, right? She's like, I consider her a friend. She's a tough cookie, though. She's harder to crack than I am.
I will call you a friend. Other people in your circle, maybe not. But you are definitely my friend.
Okay, so Kristin is with us today, and we're going to be talking about her cancer journey. But here's the thing. She had cancer when she was just like a baby. She was a youngin'. And so I saw her post on Facebook, I don't know, was it 2 or 3 days ago?
Yeah.
Where she was talking about how, like, even though she had cancer so long ago, like, it doesn't stop. Like, the side effects, so I thought that would be good because we've talked about it a little bit, that it's all the stuff from after treatment that has really kicked our butt versus during treatment. And I think that's something a lot of people don't talk about. So I had her on here talk about her journey, and we can talk a little bit about the side effects that come with cancer that are forever, it seems like.
So how old were you when you had it?
So I was 15. I was about 15 and a half. Freshman year of high school, started school. Everything was kind of typical. I started I had this cold that just wouldn't go away. I was tired. I've always been a little bit on the bigger side, so I was not upset that I was randomly losing weight. Like, I was like,
yes.
yeah, I'm like, yeah, I'm going to lose some poundage, right?
Yeah.
Like, and at 15, you don't think about things like that. You're just like, oh, I'm more active, and I had gotten my first job.
Cancer is not going to be the one thing that pops into your mind when you're 15.
And that's kind of where it is.
Yeah.
So I started having a lot of early symptoms in like September of 94. My mom really was attributing that to that I had lost a good friend of mine to, ironically, the same type of cancer I had in April of that year. So she just kind of figured, oh, she's depressed. She's not eating so much. She's not sleeping.
Stressed out. Yeah.
She's just not taking, like, I mean, you're 15, you know, you're not going to take, you don't know about mental health. You don't know about those things. And certainly not in 1995 did anyone talk about your mental health or your feelings, like taboo.
People still don't want to talk about it.
I mean, we still don't, but
people still don't want to talk about it.
I do now, though. Yeah. And I'll talk about everybody's feelings. Goodness. Sorry about that.
She's a busy
Sorry
lady.
about that. So first it was, I had influenza. Then they said I had mono. Then it was this. And so it was for months. In December of 95, my teachers actually called a meeting with my mom, and they're like, we think your daughter's on drugs. And my mom's like, no, definitely not on drugs. And they're like, well, she's just not herself. And she's like, she's not on drugs. Like, she's not. So, and I had been going to the doctor, like, I don't feel good. What's wrong? They'd give you antibiotics. And in 95, antibiotics was like, you just give them to somebody no matter what.
Yeah, that was for everything.
Yeah, like you stubbed your toe, here's some antibiotics.
Here's an opioid, take it.
Yeah. That came later. No. So we're going to fast forward to March. It was spring break, freshman year. I was supposed to go to spend the weekend with a friend of mine at her dad's house. So the night before, I came straight home from school, went right to bed, and my mom woke me up. She's like, you can eat supper. I'm like, no, I'm just tired. So went right to sleep. The next day, March 7th, woke up, and my mom was getting ready for work, and I turned around the corner out of my bedroom, and what the expletive when she saw me? I'm like, I just got up. Like, what is your deal?
Yeah.
And so she's like, Kristin, go look at your face. And the left side of my face was so swollen. It was actually like 8.5 centimeters more swollen on this side of my face. My left eye it wasn't swollen enough that it was impeding my vision.
You couldn't feel it.
I couldn't feel it. And then I kind of went and looked in the mirror, and I had all this like green stuff coming out of like where your gums and your tooth like meet. So I was just like, I think something's wrong.
Yes.
I'm
no doctor, but I think there's something wrong with me?
not a doctor, but ugh. And my mom's like, you're not going to your friend's house until you go to the actual doctor. Because I was seeing just a family practice. Shout out to family practice. I love my family practice doctor. It's not a bag on them, but my mom did make me actually go see a pediatrician.
Yeah.
At 15, whatever. And we went, and I went, and the doctor was like, Dr. Johnson, I'll never forget him. He's like, well, we're gonna run some blood work. I'm like, oh, well, they never do that. So months of doctoring, and never had I had any blood work done. And so it was Med Center at the time, went downstairs to the lab to get my labs drawn. And he's like, we'll get exited the lab office, put my coat back on. And the time it took me to walk from the lab to the gift shop where my grandmother was waiting, I was like, why is my jacket wet? So I had taken off my jacket, and I just had blood dripping down my arm from where they had where they had drawn the blood, and I and I walked back, and it's like dripping, you're thinking that I had severed an artery, but it was just dripping, and they're like, what'd you do? I'm like,
nothing.
Walked out. So they had my whole arm duct taped, it felt like.
After they took your blood, did they just do a bandage?
Yeah, it was just a bandage.
I had that
your
too.
little
So now I
4x4.
wrap. Yeah, I
4x4.
wrap all the time. I'm like, I don't care after blood. I wrap. Yeah,
I still do. To this day, I still have to. I'm like, and they're giving me a band. I'm like, that's
we're gonna go with
work
the
for
wrap.
me.
Yep, I've had that happen too.
I started bringing my own Coban when I get blood drawn, because they just look at me like, what am I is there a hot market for this? I just want to not bleed all over. So my grandma and I go back to her house. She makes lunch. The doctor's office calls, and they're like, you need to come back right now. And I'm like, weird. So my grandma takes me back, and Dr. Johnson's like, well, we're going to admit you. Your numbers are a little wonky. And my grandmother had always been, she was unit secretary a lot for medical and at the hospital. So while not a medical professional, she knew enough about things that came along. And he's like, well, your hemoglobin is 4. Your platelets are 32. And my grandmother's like 32, 3,200. And he's like, she's like, your platelets are 3,200. And I was like, okay. And he's like, Kristin, your platelets should always be above 150,000. I'm like, oh, well, I said, well, I guess I know now why my jacket's ruined.
Yeah.
And this was back when you had the Charlotte jackets, those.
Oh, the Charlotte Hornet?
Yeah.
That was the bomb.
I got it fixed. Don't worry. And my white blood cells were 77,000.
Wow.
As we all know, blood cells should not be over 10, and even then you're sick.
Yeah.
So they admitted me to the hospital. They started an IV, which again caused a massive mess. That evening, I overheard later that afternoon, I had overheard the nurses talking, and they said, well, Dr. Roskis will be here shortly. And I looked over at my grandpa, and I just burst into tears. And he's like, why are you crying? He's like, Kristin, you're fine. I'll give you something to cry about kind of lifestyle,
Yeah.
And I was like, that was Dustin's doctor. That's Dustin's doctor. And my grandpa's, who's Dustin? And asking, I'm like, no, that was Dustin's cancer doctor. And so Dr. Roskis came in, and he's like, what are you doing here? And I'm like, I missed you, because I did see him. I'd been around for my friend's treatment and familiar with the doctors and familiar with the nurses, and I know that they knew, they already knew.
Yeah.
And so I had to have a bone marrow aspiration, which they take this lovely drill into your hip. And that was great. Again, more bleeding issues, because they, even platelets. With they did the pressure bandages and everything. Yeah. So they sent me downstairs to get x-rays. I don't know what I thought. And And the whole time I'm like, this is so stupid. Like, I'm supposed to be going to Belfield to hang out with my friend and her dad. And we had this big, huge freshman spring break plan, Belfield, North Dakota.
Yeah.
You were partying it
Yeah,
up.
woo!
That was
We
your
were gonna- we were-
freshman
yeah.
spring break.
Yep, we're partiers.
Did you go to the Trapper's Kettle?
Yeah, they have the best soup. And it was March, so they still had chili and the salad bar.
Anyway, we digress.
And yeah, sorry, sidebar. While I was down getting the x-rays, they were telling my grandparents and my mom that they did not know what kind of cancer or what kind of leukemia I had, but it was looking that I had leukemia. They brought me back upstairs, and as I entered the room in that fancy wheelchair, and I saw my grandpa crying, and I was just like, nope, I'm not, nope, nope. And so they told me, and I let out like this ear-piercing scream and kicked everyone out of my room and cried for about 5 minutes. And then I wiped my face, and I'm like, okay, you guys can come in here, but one rule, like, you can't cry.
Yeah.
Like, you can't cry if you're coming in here. Like, you can be mad, but I don't want to hear it. Like, I need to have the best attitude possible. Like, there's no tears in here. And that's just kind of how we did it. Like, 2 days later, they got the slides back that said I had acute I can't ever say it, AML. So it's leukemia of the mononucleocyte. It is typically a cancer that,
You said no crying.
That was
Yeah,
then.
you said no crying.
That was in the room. That was in the room.
Sorry.
So while they were going over the diagnosis and the treatment plan and everything, typically there at that time in 96, it had a 25% cure rate for, in general, for the scope of individuals. But because my cancer had progressed so far, I had 99.3% of my white cells were cancer. We did have those conversations about, like, do you just want to go home? Like, the doctor was very wonderful in that he was honest with me. I'm like, I already know how this can end. Like, I watched my best friend die. Like, there was no BS to me. I'm like,
Yeah.
I don't care if I'm 15. I want to know the rule. I want to know. And he's like, Kristin, I'm going to tell you, you have a 15% chance of making it out of here. I'm like, okay, cool. I said, so you're saying there's a chance.
Yeah. So you're
and
saying
my
there's a
grandpa-
chance.
As long as there's a little chance, I got this. And my grandpa's like, well, just tell her she won't get better. And the doctor was like, what? He's like, Kristin has been oppositional since birth. Like, if you tell her she can, she's going to do it twice. So yeah, and typically AML is a cancer that is diagnosed either in infants or in elderly Black men. So I'm not sure how the chubby Irish Catholic girl at 15 got it, but
15.
wasn't my bingo card, but we're good. So that's kind of there.
So
they-
what'd you have to do for treatments?
So instantly everyone was talking about bone marrow transplants
Yeah.
and this and that. And they're like, well, do you have any full siblings? Or they're like, do you have any siblings? I'm like, well, I am my mom and dad's only child. I do have 2 older half siblings and 2 younger half siblings from my dad. I have a really funny family tree in that I have cousins that we share essentially 3/4 of our genetics.
Okay.
Yeah, I know, it sounds bad. My cousin and I one time, around the time
There's no
this was all
judgment.
happening,
It's all good.
my uncle's brother's wife is my cousin, essentially. So my dad's niece married my mom's brother. So that's how we kind of have,
Good.
yeah, it's great.
I mean, you turned out fine
I'm fine. Yeah.
most of the
There's
time.
just that one toe, that extra toe I had to have removed, but it was fine.
It's fine. Just chop it right off. So do they think that you might have had it at birth, or is that
Nope. They think that I started exhibiting my symptoms when I was having all those unexplained colds and
Yeah.
that stuff. That's
Wow.
when it really just started. progressing. I really think that my friend who passed away, we were friends from elementary school. I really think that we got into something we shouldn't have.
Yeah.
You know,
I was gonna ask if
very
he
much
had
an
the same
environmental.
cancer.
We
Yeah.
did. We did actually have the exact same cancer.
Okay.
And he was, you know, and when he was diagnosed, he was a 13-year-old white boy from North Dakota. So
Yeah.
it just really, you know, that kind of stuff's weird. And now I know that leukemias are traced to, you know, like different nitrates and different things in soils and that kind of stuff. So they often say that leukemia is one of the few cancers that isn't necessarily genetic. You know, like you can have a family history of cancer, certain cancers, and it's like, oh, well, you know, like with breast cancer or ovarian cancer, there's, you know, there's that family history of it. But leukemia, they haven't as of yet found like that genetic piece of it.
Wow.
So yeah, they first started talking about bone marrow. I'm like, could we just like slow down? Like, can I try
Right.
chemo first? Like
Yeah.
before we like instantly, because I don't have any siblings, I'm gonna die.
Yeah.
But and everyone was always like, when they first started talking about leukemia, they're like, oh, we want it to be ALL. That's the highest cure rate and it's got the most success. And it did at the time. However, the treatment for ALL is like 3.5 years. Like you have, and hey, cool, you know, whatever keeps you alive. But as we all know, it's not, in a lot of cases, it's not your cancer that kills you. It's the chemotherapy or the infection or, you know, all of those side pieces that really, so that's where I was like, what? AML, they said like 8 months. I got this, you know? So I did end up starting chemotherapy right away. I spent from March 7th until May 30th in the hospital. I did not leave. I did not have I didn't have a lot of opportunity to go home. There wasn't a lot of take-home meds for the stuff I was on. At the time, Kristin, which was my major medication, you know, it couldn't be exposed to light. It was running for 24 hours. It was, there was one time I will never forget. I was like, I gotta go for a walk. And obviously there's killer Kool-Aid hanging from this IV pole. And I'm like, so I like looked out, there was nobody around, and I'm like, I'll just walk up and down from this part. And this one med student, it's ironic, he's a pretty well-known pediatrician in town now, was a med student at the time, and he's like, you can't be out here with that. That's chemotherapy. I'm like, what? I said, I have chemotherapy? What are you talking about?
What did I do?
I'm like, how did I get that? It was an accident.
They were just giving me fluids.
Yeah, I thought it was just water. And the nurse was like, if Kristin is up and wanting to walk, she can walk from here to here. Like, let her have this. But it was really funny. Or I've always had a sense of humor, and I've always kind of laughed about things, and I kind of do that. Like, there was the day that the oncologist nurse practitioner was complaining about the fact that she got a bad haircut.
You don't complain about that to a cancer patient.
And a 15-year-old girl, mind you.
Right?
15-year-old girl. She's like, I just don't know what I'm gonna do with my hair. And I came up behind her. I'm like, yeah, mine's a mess too. And I like looked like the crypt keeper at this point. Because like I am keeping it. Like everything I got, every last hair is staying on my head. And by last, I mean there was probably 3. And she was just like, oh my goodness, I'm so sorry. I'm like, no, that's funny. Like that was a good joke, right? So yeah, I basically spent my summer in the hospital. But like I said, there were times I got to go home. I attended Wachter Middle School, and when you're in freshman there, you know, they have like this big, huge Renaissance, and you're studying Shakespeare, and they had the Renaissance Festival day, and I'm like, I'm going to this. So I made sure that I could go, and I show up to school and the chaos that ensued, because they're like, well, you're not supposed to be here. And I'm like, well, I'm here.
You mean like on this planet?
And they were like,
here at the
well, Kristin,
school.
you're in the hospital. I'm like, no, right now I'm standing
Not
in the
now.
lobby at
I'm
Walmart.
right here.
They're like,
Yeah.
they're like, well, you need to call and let us know you're coming to school. And my friend that was beside me, he's like, so you need to call when you're coming to school, like, apparently. So we worked it all out. Apparently I'm not allowed to go to school without letting the school know.
Well,
And then it was just funny because like the teachers were like, you have to use the teacher's bathroom and we'll get the janitor to clean it first. And I'm like, I'm fine.
yeah.
But it was good. It was just those kind of things. Or a friend of mine had her 16th birthday and I wanted to go, and they're like, Kristin, it's really dicey. You don't, your white cells aren't rebounding. And so I agreed to like wear this like the mask I had to wear makes COVID-19 masks look like a treat.
You look like Darth Vader.
I essentially did. Like it was like breathing in it was just like I
It's
literally
like Contagion.
I literally felt like I was Darth Vader in the whole. And we went to the bowling alley. Well, I could feel I was getting hot. And like if you have a fever, you have to come back. And I'm crying. I'm like, I don't want to leave my friend's birthday party. And my friend was like, nope, you got to go. And so we moved her birthday party from the bowling alley when Midway Lanes was still open. And we moved it to the hospital. And the nurse was like, well, visiting hours are over. And I'm like, yeah, we're doing this.
Yeah.
Like, so it's just kind of those things. I rang my chemo bell October 15th.
No.
That was my last.
No, bully down. No.
I'm telling Lainey.
Her daughter is my dog trainer.
Not very good.
Yeah.
Hey,
Not
my
Lainey.
kid is great.
No,
Lainey's
not Lainey.
great.
The dog.
I was gonna say my daughter is a phenomenal dog
Actually,
trainer,
she is.
and she will tell you it's probably lack of parent follow through.
Yes. It totally. I guarantee it is.
I'll tell you what happens is he only barks when he has to go potty or when he sees like a delivery driver out.
Yeah. That's what dogs
Because
do.
he knows he gets treats, and I can't. Yeah.
Oh.
He knows he gets treats.
And
from the
there's
delivery
delivery
driver.
drivers here right now.
Yeah, son of a bitch.
So yeah, I my chemo regimen was from about March of 96 until October of 96. Super short period of time, when you think of how long we've all progressed through these things, but
Yeah.
started my sophomore year of high school completely bald. That was great. I was like, I'm gonna get a wig. Wore it for like 15 minutes and
You're like,
shoved
"Oh."
it in my locker. Like, forget this. And then the lockers at BHS, like just the little pieces of the hair were out of it.
God.
So it was great. Like it was awesome. My one friend was really excited that I got to park in handicap parking. So everyone wanted to ride to school with me. Yeah. So, I mean, hindsight, super
It
terrible
was kind
thing.
of a good thing, yeah.
But like I got really close parking, and in '96 there was not the parking at BHS as there is
There
now.
still isn't.
There
it
was still like the
sucks.
houses, and like
Uh-huh.
that was way before all of that. So yeah, that's kind of that piece of it. But
So 30 years later,
it's not
what do you have
30,
now?
it's 28.
whatever. What do you have? Anything?
So like I said, as I even said in my post, like, I had vincristine was one of my major medications, and it causes nerve damage. It causes, like I had said, like my hands and feet go numb like nobody's business. And like I said, I guess
Yeah.
it's neuropathy, I guess. is what they-
Neuropathy, yeah.
it's numb, but dang, does it hurt, my chiropractor, Cody Berger, is phenomenal. Like he will get me in at any time to try to help with alleviate some of those pinching and that trying to release those different nerves and stuff. I don't know where I would be without his chiropractic care. He really does help a lot with that. And so, weight, I basically didn't eat for 8 months.
Yeah.
So that's a huge thing. Like no matter, I eat pretty healthily. I exercise, like but I'm never going to be thin. My metabolism just cannot recover. And, everyone's like, oh, well, why don't you try Ozempic? Or I'm like, it's not that. It's not one of those things. And so when I do see my doctor every year for my annual physical, and she'll be like, well, what are we going to talk about? I'm like, I don't know. My blood pressure's great. My cholesterol's fine. I don't have high blood sugar. And I'm like, I'm fat. And she's like, well, good. We're glad we covered that over, So, I mean, there's obviously, like, yeah, obviously my body having extra weight isn't beneficial, on your joints and things, but I try to stay as active as possible. My daughter is really into like running. I'm not running, but I will do I'll do a 5K with her, or, just really staying as active as possible. So that's the big piece. They told me one of the big things, and it was Dr. Roskis was like, hey, I know this is going to be really upsetting to you, but the chances of you having children is very slim. And I'm like, I understand that. I said, I'll be a mom one way. It doesn't matter how I'm a mom. Joke's on him. I have 4 kids.
There you go.
So they are, my oldest is almost 21. My middle 2 are twins. They will be 19, and my son will turn 17 at the beginning of December. I can't believe you just threw a pen at the dog.
That's good training.
I have extra pens too. Just keep it up, sir.
So yeah, like it's those types of things. Or I do suffer from headaches pretty significantly. Again, it's that nerve kind of. It's like the big joke is like, so your brain, you have neuropathy of your brain. I'm like, nope, just the outer layer.
Yeah.
So it's kind of that. But really, honestly, I'm very lucky. I've said this before. And obviously no one's going to wake up and be like, yeah, I'll take cancer. But the things that I've learned about myself and those around me and my priorities, and it really is a blessing. It was a blessing. I'm very lucky. Still maintain friendships with some of the individuals that I met during my hospitalizations. Andrea was 3, and this little teeny tiny terror that was in the room next to me, and we talk every day, and it's those types of long lasting friendships and experiences. And like I also think back to who would I have been if I didn't have this, because obviously you get a different sense of self when you have cancer. So like I look back to some of my childhood friends, like I was excited to go to Belfield, North Dakota for spring break.
Yes.
I'm guessing we weren't going to church. You know what I mean? So like it really did awaken like, hey, are these the choices you want to make for yourself? Are these the things that you want to participate in? So it really did give me a wake up call on the choices I was making at 15. And I'm appreciative of that. In March of 2013, I like totally cyber stalked my pediatric oncologist and found out that he's in a clinic in Florida, and I emailed him. And I was just like, hey, I want to say thank you. Like this is the life I have now, and all of these things. And you always think like, oh, we're just a number on a chart, or we're just this or that. But Rudolph Roskis, we weren't that to him. Like I said, it was, what is that? Almost 20 years later, I email him out of the blue, and he was a runner, and he didn't eat chocolate, and he was a very healthy person. And I had developed a complication whenever I would have to do, Versed is not a medication that I can use easily. So they would use Versed to try to help kids forget about like the procedures for your bone marrow aspirations or your spinal taps. And I would just be so miserable. I would wake up screaming and crying and flailing. And then you've got like, the slight overdose of opiates to get you to forget everything. And opiates and me are not friends. So that's good, right?
Yeah. Unless you're in a lot of pain, then you're like, yay, Tylenol. Like,
yeah, like my liver
Yeah.
shot ibuprofen is just my candy now.
Yeah.
I mean, Toradol is still pretty good.
Toradol, man. They gave that to me when my kidneys failed.
Yeah.
And I was like, they're like, oh, I'm sorry, we just gave you Toradol, but you said your pain was like at an 8 or 9. I'm like, well, that's pretty high, isn't it? They're like, no, that's like Toradol high. That's not good stuff high. I'm like, oh.
ibuprofen on
fine.
steroids. Yeah.
Yeah. But it works for me, but he when he responded in the email, he's like, I remember I used to make him eat chocolate. I'd make him eat a piece of chocolate before I would do like my bone marrows or that, because I would do them essentially without any pain medication.
Yeah.
They would do a little local for the sting of the needle, which doesn't make any sense. You're literally grinding into my hip. It's fine, but yeah, let's worry about the skin. But yeah, so he goes, every once in a while I walk by the Reasons chocolates and I think of you. Because I'd make him eat it. I'm like, you wanted me to do this and you do this. And he's just like, oh. Or he had helped me with some of my algebra, he brought that up. So it was just kind of cool to see that and kind of hear that they think about us too.
Yeah, that's cool.
But that it also hurts your heart because there are so many people. There's so many, and I mean it's fitting. It's September. It's Childhood Cancer Childhood Cancer Awareness Month, and it's just fitting. Like there's so many kids that if he thinks about the ones that survived, I can't imagine how his heart and head feel about those that he didn't.
On the other side,
I mean, there was a 6-month-old baby who had the exact same cancer that I had that did not make it. So yeah.
I don't know how those doctors and nurses do that. That's just the job, right? Like it's what it is.
Yeah.
But hey, we thank you for your story. It was awesome. I mean, you look good.
Thanks.
You sound good.
Do you have any pieces of advice for people that are experiencing after effects of cancer?
Being honest with it. It's okay to tell people like, hey, this really hurts or this really sucks, or
because I think people forget.
You
like,
forget,
they forget,
and it doesn't matter. It was almost 30 years ago, but sorry, my feet are still. I'm hobbling around because guess what? I can't feel.
Yeah.
And don't just assume that it goes away. It doesn't. There are days where I'm just a pile, and it's because every nerve in my body is a firecracker. And it's not like it's not because I'm like, oh, give me the drugs. I'll get through it today, but I'm not going to be running a marathon today.
Yeah.
And having that grace with that, and people just need to realize that it was 30 years ago, but guess what? It's not smooth sailing. Like
Correct.
It's life.
It's altered your body forever.
It's altered your body. It's altered your body chemistry. I can't get a vaccine to hold in my body to save my soul. And I didn't have a bone marrow. I didn't have a bone marrow transplant. But like I'm 40, almost 44 years old, and I still have to get an MMR booster because rubella, my body does not hold on to the antibodies for that.
Oh.
And it's probably because of that. Don't assume because someone's teeth are horrible that it's because they don't brush. Nope.
Yeah.
I have rings on my teeth that make it look like I'm a 6-pack a day smoker following up by coffee. And it's just because the enamel on my teeth is garbage because of all of the chemotherapy and the medications. And like you literally are putting poison into your body. Like it comes with a skull and crossbones on the
they
on the bag.
They suit up in a hazmat suit to administer
and I always say that,
to you.
Or they'd be like, okay, well we have to run this much water and then we'll push this and then we need to super fast flush because it'll erode the tubing of your Hickman. So we're worried about the plastic, but we're cool with my
your
vein.
body.
Your body's fine. Yeah.
Yeah, it's fine. No big deal. And we always joke that the biggest like physical lasting effect I have is I had a Hickman catheter, which it's different than ports and stuff nowadays. And so it was actually it had 2 external lumens. And I always joke that the biggest thing I have is when they removed it. Apparently it was a bad day for that guy, and instead of just like clipping the sutures and pulling, he just cut out a big chunk of my skin. So I have this scar on my chest, and I'm just like, yeah, it's huge.
What the heck?
Yeah, so instead of just like clipping some stitches, he's like, well, this was less painful. I'm like, I don't think it was.
Thanks, Doc.
I'm like, the boobs are the one thing I still got, and now there's a big hole in it.
There's a big hole in there.
There's a big hole now. It's like, come on. That's all I got out of the deal.
That's funny.
Cancer Convos is sponsored by Chelsea Smith Cosmetics and Bismarck Cancer Center. Once again, if you have a story to tell, we'll let you tell it here on the Cancer Convos podcast with me and Stacy. Have yourself a great week.